For all your pastry, bakery, and quality food, CK Restaurant is the only place to be. We do catering for birthdays, weddings, and all related services. We have all kinds of local foods, American, European, and even beyond. Come and have a taste of our local juice, ebe, and other services. At CK Restaurant, customer satisfaction is our priority.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3, or 4 bedrooms, or our story buildings, 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
Good morning to you all. As mentioned earlier, we're here to make a declaration of the poliovirus type 2 in the Gambia. As you may be aware, a lot of global effort has been made towards kicking polio out of the face of this world. In 1988, the Global Polio Eradication Initiative was launched to guide global efforts to eradicate polio. Since then, the annual global polio incidence has decreased by more than 99%. The Gambia last detected a polio case in 1986 and was certified as polio-free in 2004. Over the years, the country has achieved and maintained high polio vaccination coverage in its commitment to global polio eradication goal. The country also conducted 27 high-quality supplementary immunization activities from 1997 to 2014 to boost immunity against polio. These activities were carried out in the presence of a robust surveillance system to detect polio cases when they occur. In May 2021, with support from the World Health Organization and other partners, the Gambia initiated environmental surveillance to supplement the traditional, that is the acute flaccid paralysis polio surveillance system. Presently, environmental samples are collected from 3 sites in the Gambia. Samples collected from the acute flaccid paralysis cases and the environment are sent to the regional polio laboratory in Dakar for analysis. So far, no AFP sample from the Gambia has tested positive for polio. However, 2 environmental samples collected from the sewage sites, one from Banjul and the other from Kotu, have tested positive for poliovirus type 2. This has created a polio outbreak situation in the country, since a single positive poliovirus case is considered an outbreak under the 2005 international health regulations, thereby requiring an urgent response to breaking the cycle of transmission. Many other countries are already affected by this type of virus in the sub-region. Sequencing results show that viruses detected in the Gambia are genetically linked to other viruses detected in the sub-region, such as in Guinea, Senegal, and Nigeria. Thus, there is evidence of importation of this virus. It is important to note that this outbreak is an evidence of poliovirus circulation within the population, but does not mean a detection of polio paralysis in the population. In line with the WHO recommendations, polio outbreak response standard operating procedures, and the International Health Regulations 2005, I officially declare this outbreak a national public health emergency. The Ministry of Health will continue working with all relevant UN agencies and other development partners in confronting the outbreak. While we plan for vaccination response shortly, we have enhanced our surveillance system to increase its sensitivity and quality in tracking poliovirus cases in circulation. We are preparing for at least 2 massive supplementary polio vaccination rounds, targeting 382,908 children who are 0 to 59 months of age in each round. Our goal is to vaccinate all children 0 to 59 months in the Gambia. We implore all parents to cooperate with our vaccinators during the vaccination campaigns to enable us end this outbreak soonest. The Gambia has one of the best immunization programs in the sub-region. Thanks to the caregivers for being receptive of the vaccination programs. Together, we have been able to defeat many vaccine-preventable diseases. There is no cause for alarm, and we'll work together, inshallah, to break the cycle of transmission, in this case, too. I thank you very much for your kind attention. So we'll allow our colleague here, who works with this vaccination, this immunization program, to give you further information on that, right?
Disease. That is how it is transmitted. Thank you.
So how quickly?
This depends on many factors, including the concentration of the virus in the stool, and also whether you are vaccinated yourself or not. So, but it is not as infectious as diseases like measles, in which one case can, in an unvaccinated population, can give rise to up to about 18 cases or so. I think for polio is even maybe about 5 or so. But considering our vaccination coverage, and if we continue to vaccinate more people and children are immunized, then we will be able to break this transmission chain very, very, very fast.
Yeah.
So
yeah, go.
So, like he rightly mentioned, this virus is genetically linked to viruses in the sub-region through the genetic linkage that was done. But then, for now, we don't have evidence that it is causing paralysis. Yeah? Not every infection may result in paralysis. But if we don't have a sufficiently high vaccination coverage, then we may end up seeing some problems. So that is why our most important, the most important thing for us to do is to make sure we allow our children to be vaccinated once we start this vaccination. Yeah? And as part of our response activities is to strengthen our routine vaccination. So that is already being done. we are vaccinating our children against polio, and we'll continue to strengthen that to make sure even if they come in contact with this virus, they will not be able to get the disease. Thank you.
Thank you. So I think it's also very important. He's mentioned the route of infection. That's fecal-oral. Oral means mouth, fecal means feces. So that's the cycle. People getting contamination of what gets into their mouth. So that's why hygiene is very, very important. Proper disposal of feces is very important. We've all seen what happens to feces in the community when children pass stools, and then how they are discarded. And so that's why hand washing is equally important in this, proper disposal of feces, and the way the children are cleaned after, passing stools. Too often than not, kids are cleaned, but the caregiver doesn't use soap and water to wash the hands. We've seen that a lot. So that causes the cycle to continue. So I think it's very important that personal hygiene by the caregivers and the proper disposal of the feces is maintained. For many of these viruses, usually when viremia is high, when they have the actual symptoms, then they are able to shed more of the viruses in the feces. And the more viruses they shed, that means the more contaminated the feces become, and the more, the greater the chance for infection to occur through the fecal-oral route. So typically, someone jokingly said, for people to get fecal-oral infections, that means they would have consumed the feces one way or the other, whether it is in the water or from our hands or from the hands to the food or the food, because it gets to the feces and to the mouth. And how does it get to the mouth? That means we would have gotten something in the feces that goes around back to the mouth, right? Yes.
Before you, let me have one again.
I'm on lines, right? Working TV. For layman, to understand, there are two cases of environmental-related cases of the polio virus here. I would want to know what are the chances of infection when it comes to such cases, and for the general public to understand, if you guys can simplify what those environmental-related cases mean in this state. So about the vaccination campaign, I understand that the ministry is preparing for a massive vaccination, polio vaccination in the country for children between 0 to 59 months. So I want to get the figures there. I had 180 plus from the minister. It's like
82.
Yes, 380.
82,000, I guess. 908. Yeah.
So that's the question.
Okay, thank you. I think let me have the gentleman question before we respond. Yes.
Yes, my name is Usman from Giates. Mr. So did mention paralysis as one of the signs of the type 2 virus. Aside that, is there any other sign apart from paralysis?
Oh, thank you. So back to TTV, chances of infection. What are the chances of one getting infected? And also, when we show environmental serious cases, what does it mean to everyone?
Okay, thank you very much. First, I think maybe I will start by explaining what environmental sampling is. So, like the Honorable Minister rightly mentioned, traditionally the global gold standard for polio surveillance is looking for acute flaccid paralysis cases, meaning people who present with some form of weakness or paralysis that is floppy-like among children under 15 years. So as we move towards eradicating polio, that is kicking polio out of the face of this world, then efforts became more intensified so that we get all possible chances of detecting the virus if it is in circulation. Then this environmental sampling came in. Environmental sampling, what it means is you go to places where feces or sewage is, and then you collect specimens or samples and test them for poliovirus. So in the Gambia here, one of our sites is in Banjul. we know Banjul has a sewage system, which all these toilets, etc., are connected to. So a sample is collected from them and tested for the poliovirus at the Nawek site. And then the other one at the Aqua Gambia also, we know many vehicles or many areas do use it, including the tourism development area. So for now, it is these samples that tested positive, but we are not able to say it is from this specific person. So this person is, or these people are with us in the society. There may also be people who were just traveling or passers-by. For example, Banjul, we know that many people use Banjul to cross to the ferry service, etc. But we are not able to say it is from this person. So the risk of infection is there if this person is in the society. So for polio, not every infection will result in paralysis. Paralysis is the most severe form of it. Usually about 1% or less will result in true paralysis. About 20% or so will just have a flu-like symptoms or febrile illness, and then the rest may be asymptomatic. But if this percent is, if so many people are infected, then even 1% becomes a very high number, right? For example, in 1988, there were over 350,000 polio cases. So that is a very big number. Yeah, I'm not sure if I answered your correct.
You know, when exactly it was sampling?
Okay, the first Gambia initiated environmental sampling, like the Honorable Minister mentioned, in May this year. Yeah, so these samples first specimens collected did not test positive, but those collected on the 9th of June tested positive for poliovirus, and we received these results on the 23rd of July.
Thank you. So I think.
Yes.
So from GRTS, or you want to add something?
No, it's okay.
It's okay. So GRTS said, aside from paralysis, I think you've mentioned, what are the other consequences from
yeah, it's just flu-like symptoms. You can have high fever, even headache, those kinds of things.
General malaise.
Yeah, general malaise, myalgia, etc.
Yeah, muscle aches and pains.
From the samples that were collected and you realized that the disease is detected, are you able to know maybe how many percent of the population might have? Because this is something that almost, let's say, the sewage, almost like many people, right? So I don't know if at all through that test you'll be able to, because I don't think like one person will see having this and then having the sewage be able to. I want to know exactly how many percent of people might have this virus for you to be able to detect that this is yes.
With media house
The Fatou network.
Do you have any other questions?
Yes, London Cisse from Kerr. Yes, I came late and then I found the minister talking about the COVID-19 and the fake news or misinformation. I have a question about the verification of the COVID-19 vaccine that ended in the country that people are taking. I want to ask the minister whether the COVID-19 vaccines that are available in the country are well verified for people to take, because there are a lot of misinformation and disinformation surrounding the COVID-19 vaccine. So I need that clarification from the health minister.
Yes.
My name is Donna Madison. My question, from the onset, you have been talking about children training. Is this a virus that only affects children? And if yes, how deadly is the virus?
Any other?
Yeah, I have a question. My name is Ridwan Ahmed Snaiko from the Chronicle. My question is based on the minister's speech about the virus being detected in freezers. We've noticed that in most places like around Taninding, people do dump their waste materials outside. So how best do you think you can bring a change in making it awareness to the people of those communities?
Maybe now again back to Ali.
Yes, sorry, yeah.
Yeah, so with the question from Fatou Network, yeah, so it's, yeah,
Percentage.
So, yeah, the
Yeah.
population.
Okay. Thank you. Thank you very much. That's also a very interesting question. Unfortunately, for now, you cannot tell from just environmental samples because to be able to calculate the percentage or a proportion, you will need to get some kind of numerator and denominator, which is not feasible to do. So what can be done from the specimen is to sequence it and see which viruses it is related to or something like that. And from the sequencing results, it is found that this virus is like the sample from Banjul and the other one from Aqua Gambia, they are connected to viruses from Guinea and Senegal. Yeah, so meaning they are somehow originally from those viruses. And if you taking all these viruses together, they are from actually they are related to the is it Jigawa outbreak in Nigeria? Yes.
Yeah. So Kerr says the verification of COVID-19 vaccine, whether it has been actually verified because there is a lot of misinformation.
Yeah, thank you very much. Certainly, before vaccines are introduced into any country, they go through a lot of processes. They go through robust checks and balances. Of course, I think one of the most important steps is to get vaccines from a verified source. That is why we always rely on recognized institutions for the supply of vaccines. That is a very good starting point because we've already seen in certain areas individuals talking about supplying vaccines to countries. Gambia is not taking those offers. Gambia is getting vaccines from recognized international sources. And even with those, a lot of paperwork is done with regards to verification. A lot of information is supplied to the country, back and forth. We send this information to the Medicines Control Agency of the Gambia that looks at all this available information supplied by the vaccine manufacturers and the suppliers before we get a go-ahead. In fact, even though we are government, but to get vaccines into this country, we wait for the go-ahead of the Medicines Control Agency in the Gambia. In fact, the last time we were waiting for their approval. Vaccines were already somewhere, but we had to get their approval. So even government follows those rules. And then in the country, we have what we call NITAG, National Immunization Technical Advisory Group. That is a group of experts that looks at these vaccines. They look at what prevails elsewhere. They look at the type of vaccines that we are getting, and they look at all vaccine-related issues, whether it's COVID-19 or it is polio vaccine or hepatitis or BCG and so on and so forth. So we have robust systems in place to ensure that we get the best vaccines in the country. Unfortunately, the people who give misinformation, they don't give up. As you answer this one, they will come up with another one. You know, unfortunately, what keeps on puzzling me is what their motives are. Why people will be interested without evidence to misinform people. Because they don't have evidence, they don't have information, but they rather misinform people. And I keep on saying it's very sinful if people potentially could benefit from something, and then they get misinformed and they don't get that, they don't get the benefit, and they end up dying. It's very, very sinful. Now, somebody said, the people who know and they deliberately reluctant, their own is a little easier for him, even though we want to encourage they themselves to take. But he said he pities the people who are now confused because the institutions, government is saying, do this, it is good for you, and they want to believe it. On the other side, somebody is saying, don't do it, it's not good for you, and they are in the limbo. Those people, because of lack of information, or misinformation rather, they may not take the vaccines. And we have seen a recent case of that. A young man in his late 40s, with a very young family. These people were saying, get vaccinated, and he didn't. Unfortunately, less than 2 weeks ago, he contracted a very severe form of COVID-19 and he passed away, leaving his 2 wives and small children, at home. So that is very disheartening. His cousin, whom I know, took the vaccine, but they say they've been telling him to take the vaccine and he wouldn't because of the misinformation. So this is how serious misinformation really is. Yeah, thank you.
Thank you. So from daily news, children are the only affected, and if yes, how deadly is this?
Okay, polio is a disease that can actually affect anyone, but the most vulnerable are children below 15 years. So that is why global efforts are concentrated towards this age cohort, except in a situation that, based on the epidemiology of the disease, we realize that the adult population is also affected, in which then we would extend our response activities to that age cohort. If not, it is usually restricted to this. So I think with regards to the deadliness of this, I think I mentioned earlier that about 1% of cases would likely end up in paralysis. And we know that also poliovirus, it can also affect the nervous system, the brain, and even affect how you breathe and things like that, resulting in death. So it is a very dangerous disease. In local languages, Mandinka, it is the disease people used to call dino. So if you ask our fathers and grandfathers, they will tell you about it, and in all of February Lafang.
Yeah. So typically, children are affected. They are more predisposed. Many of these infectious diseases tend to affect children more. Various reasons are there for that. If you even look at the route of transmission, children are the ones usually crawling on the floor. Children are usually children can even eat droppings from other children. They put whatever they pick on the ground into their mouths, if the environment, so they are predisposed. But their immunity is also not as robust as those of the adults. But the poliovirus, too, the way it operates, because, these microorganisms also have adaptations. It affects the central nervous system. When it does that, it affects the motor roots of the limbs. So that is why when it affects that, it actually causes paralysis of that limb. And when it occurs in a developing child, that limb gets paralyzed. The muscles are weak. It affects the growth of the muscles. It affects the growth of the entire structure. That is why you have the individual limping on that side with malformed muscles, and even the limb tends to get shortened. The foot gets shortened and so on, and they limp. You have all realized that we are no longer seeing many cases of that in the whole world, especially in the Gambia. It used to be a little bit more common, but that is why we don't want that to come back. That is why we are making all these efforts to make sure that polio is dealt with from the onset. Thank you.
Thank you so much. So I think the last question comes from Chronicle. He is concerned about the environmental situation in some sites or in some communities. And how to change this kind of good behavior, and what are some of the awareness plans or creation plans that you have for this area?
Thank you so much. I think maybe this question, I'll answer part of it, and the Honorable Minister maybe will say more. So, thank you so much. With regards to Talinding, myself, I never thought such actually exists there. So what we were aware of it, and because of that, Talinding Darussalam is one of our environmental surveillance sites, but so far we have not detected a case from that. So what I think I'm happy to say that the Regional Health Directorate is very much aware of the situation there, and they are even doing a lot to address it in terms of sensitizing people and taking public health measures. And in fact, that is why we knew about it. Usually, when it comes to environmental sampling, people tend to focus more on sewage systems, more proper sewage systems or drainage systems. What it is from also our discussions with them that we came to know about that area, and then we included it in one of our environmental sites.
Yeah, thank you very much. Of course, with control of diseases, hygiene is very important. So any society where hygiene is poor, infectious diseases tend to exist to a large extent. Societies that have been able to deal with hygiene issues, whether it's sewage or whether it is cleanliness of solid waste in the communities, infectious disease rates are lower. So Gambia, that's what we are striving towards, but it's collective responsibility. Government has rules and regulations guiding the refuse dumping, management of sewage, but people should also abide by them. We heard of the issue of Talinding. I've not visited there yet. I hope to do so soon, but the Public Health Directorate inspectors will be tasked to go and look at it. We learned that people are opening, waste disposal systems directly into a gutter, which is really, really not good. So public health people will go there and try to deal with that. But it's the responsibility of individuals to make sure that sewage is disposed of in an acceptable way. So it's our collective responsibility. The media, you also have a big role to play. Sensitize people. Tell them that what they are doing is detrimental to the health. And a lot of people will listen because they just need to be convinced. And our team will also continue to engage the media. The risk communication and behavior change unit is always doing that. But it's a continuous process. So we will enhance that, inshallah. Thank you.
Let me just thank you. The Director of Public Health Studies is allowed. But we've actually done some effort. You recall some years ago, government introduced a multi-sectoral intervention program. We call it water hygiene and sanitation work between the Ministry of Water Resources, Ministry of Health, and the Community Development. And the aim is to eradicate eutrophication. We've been working on this thing, but the intervention was focused in the rural area to ensure that all households are provided with cheap lighting, so that this kind of environmental or hygienic environment will be in the urban area, we is a challenge to introduce this concept, but we've been doing very well in the rural area, and I think we are now making time in the urban area. In most of the growth centers, like Soma Parate, we made an attempt to introduce the concept. So the whole idea is to make the environment clean, so that we will not have this kind of environment where this organism can happen. So I think we've been doing a lot, and we will continue to do that. We are doing it with water resources and community development.
Okay, just to add on to that. Yes, we are in cognizance of the importance of the environment with regard to open defecation. So currently, we are going in for GIS mapping for OD communities, that is open defecation communities, and also open defecation free communities. So we'll have this in a system, in a database, so that we'll know day in, day out the improvements taking place. If a community becomes OD free, we'll easily know, even by sitting here, we'll be able to, based on the coordinates, we'll be able to know which one is doing better and which one is doing worse. Yeah, so we'll be able to coordinate very well. This is based on improving environmental sanitation and hygiene. Yeah, so that is on course.
Thank you so much.
Yeah.
I guess this brings us to the end of this session. Just for a home message, which is also important, especially for the latecomers. The Minister of Health has just declared an outbreak of polio type 2 in the country. Of course, you all had to say 2 samples were tested positive for polio type 2. And this calls for a declaration of an outbreak in the country, which he just did. And there are plans from the ministry to embark on mass vaccination campaign, targeting close, I think, 282,000 children. So, which is also going to be very, very much helpful in addressing the situation. But again, it's also important, as we said here, aside from vaccination, we will continue with the environmental surveillance, and the public also will need to cooperate with the health authorities, which is very, very important, especially when it comes to the vaccination program. So I think this is the message that we can take home and make sure we sensitize the public on these issues, especially when it comes to environmental sanitation, when it comes to hygiene. I think these are very, very important. So thank you all, and we wish you a safe day.
Thank you very much.
Agada di.
Mbijan aganya.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyinji.
Okay. Important. Nsila ID soto.
Ah, sa soto. Sorry. Agada di.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariaka.
Ah,
mbare. Mo ki janna nun kunu bara tariaka.
Ah, jannom yona forest de bureau. Gambia tonkon na lo mbari ya bere. Ha. Birim koyna fo katon.
Bari si kodo kino katon ni fo bolong blabe.
56 branches mola soto Gambia jam.
Ha?
Ha. Gambia kono ani Gambia e bantala bankol. Nko kodo kiya bere. Kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nin kodi maraw. Jannom number 1 di nyonta. Andum fana nata anoda enterprise sotale. Wolam nyindi ko domorol fana kol fana be firale le dadi mani domorol dir fana beteat. Gambia dawda yalo ngam fa kendol sotale je.
Ha e wo moyo diat ha.
Apelenta
barka ba. Ni lafta nyelen kendol e bina.
Yalo bukani la ko la barka ba.
Yalo ndel chosano lo.
Abarka.
We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us. Innovarex Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle. IGH has remained committed to creating the future of healthcare delivery. Gone are the days of sending loved ones outside the country for basic medical services. Innovarex Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.